Good morning and welcome back to this week's episode of Live at the Legislature. This week, after about a month off, the legislature has reconvened back into session, and joining us this morning is Representative Bob McDermott. He serves as the Assistant Minority Leader from House District 40, which represents Eva Beach, and Representative Jean Ward, who serves as the Minority Leader, representing Hawaii Kai in House District 17. 17. Good morning, gentlemen.
Good morning, Kyle.
Rep. McDermott, we'll start with you. What are your thoughts on being back in a session?
Well, first I want to thank all you folks who make this possible. Lelo, you, Kyle, all the staff, 100 hands behind the scenes. People don't realize what it takes to pull this off. That said, it proved pretty prudent and wise to wait a certain amount of time before once we got that federal funding, instead of spending it all right away, because this delay has given us an opportunity to see the lay of the land, if you will, where the greatest needs are and some of those things. So I think it was prudent. Of course, there's a deadline where you have to spend the money by. So that's what we're going to be addressing today and tomorrow, this week, actually. So we will get there. It is still heartbreaking to see the families with you get these surveys that say, what is your most important concern for your constituent? And it used to be, okay, well, the school facilities are behind par. Now it's, I hope they have insurance. I hope they have food. We're not at that crisis yet, but some families are. And how do they pay their rent? And these are really surreal times. And we're doing the best we can with the tools we have. And one of the things that we need to do is to get the economy going again. And Jean and I started a plan probably 2 months ago now, where we laid out making Hawaii safe for travel. Since then, there's been a community consensus developing around that. Josh Green was out there early. Hero came in and basically said the same thing we did, but they have a ream of data to back it up. Ours was a policy framework. We don't have all those scientists and research analysts working in our offices. So there seems to be a community consensus that we want people tested prior to their travel here. 72 hours seems to be the number people have congealed around, which Jean and I put out there. And one of the things we have to remember is the visitor industry, the hospitality industry, those employees service those folks, and we have to keep them safe. And I'll turn it over to Jean here to amplify in just a moment, but they are going to deal with fresh viral loads of COVID every day if we don't test. I mean, we're not Kansas, we're not Detroit, you have a relatively stable population. Our population changes every day once we start ramping up our numbers.
All right.
So Jean, why don't you take it from there?
Okay. Good morning, everybody. Am I on? And let's see. The technology says that I'm still looking at Rep. McDermott, but I don't have to see anybody. Okay, got it. First, notice Representative McDermott and Representative Ward are not wearing their ties. So we're not live at the ledge.
Not yet.
We are live at Eva Beach in Hawaii Kai. I think that maybe is the first line of approach here. What we've got is a number of things going on today, conference committees particularly, and then, as Bob has alluded to, shoring up everybody's livelihood, trying to make something out of what otherwise there's a lot of fear, a lot of anxiety. And our concern is, and I'm going to focus on what Bob just said about the travel industry, because we've got 100,000 workers, we've got $17 billion plus that's on the table. And either we're going to subsidize all those people not doing anything, or we're going to open our economy. This is really a test for leadership to not be overly sensitive to health and not be undersensitive to economics, or oversensitive to economics and undersensitive to health. It's really a test of leadership. Earlier, you mentioned the Kawakami plan. Kawakami is a double plan where you get tested in the airport, of which Bob and I said is going to be expensive and cumbersome. And then you go to a quarantine. Bob, they've got the quarantine right. You're going to be very specifically putting people aside and testing them after the seventh day. According to the Kauai plan, according to their numbers, they have 100 cases come through every 10,000 visitors. That's a pretty good hit rate, 100 out of 10,000. The way that and this is where I'm going to get a little bit critical. The bill that I saw that we're going to hear this afternoon basically says, DOH, you're in charge of testing. It doesn't specify what we're talking about, Bob, in terms of testing, the way Josh Green and the others that you mentioned. Before you get on the plane, you go to CVS or you go to Walgreens, you get tested, you get on the plane, you come here, you're not put into quarantine. What is in the bill that I'm going to be on the conference committee says basically DOH can do anything they want to do and they got all the money. Now, all of you know of the statements that have been made by the director of health, by the head of epidemiology. They are not for testing what Bob and I are talking about, or what Kawakami is talking about, or what even the Alaska plan. They have publicly come out and said this is not doable, this is not workable. But the irony is we're giving them all the money and all the authority. We're giving them emergency powers on top of the emergency powers they already have. So my fear is, we're not going to be able to get those people to Eva Beach the food and the wages they want, or the people in all of the districts. We are going to be over biasing towards, well, we want to make this really tight. We're going to push thermal screening. And I heard yesterday when I got screened at the Capitol, they're going to do facial imagery. But we are not in Hong Kong. We are not in mainland China. We do not need to do facial imagery. And I heard that's what they're paying the money for to do at the airport. And actually the contractor who supposedly won has some connections with some of those nefarious companies. So Bob, I'm bullish on that. You know, we started months ago on this. We wrote it down, first ever in the state of Hawaii. I was the one who opened through the White House. We got the green light to do this. Everybody, when we started out, said, hey, you can't do that, McDermott Ward. There's a DOT and FAA. Well, through the White House and through our GOP connections, we were able to get the green light to Hawaii. And Kaio, I want you to dig up my tweet that preceded even when Ed Case announced that he had his letter from the DOT. Show that we have been a player in this. We're not going to get the credit. And I'm wondering what Ike is going to say this afternoon in terms of what he's going to do. Is it going to be a Kawakami plan, or is it going to be kind of a timid, tepid Henderson and epidemiology Sarah Parks plan? So those are a couple of openers by which this afternoon we'll see what's going on.
Yeah.
And so going based off of that, for the viewers at home, the governor is expected to announce a testing plan for travel that will likely require COVID-19 testing either before you arrive to Hawaii or at the airport. And so McDermott, I'll go back to you on that.
So as long as, you know, the quarantine has been effective in the sense that it's chased away visitors, it's kept it down. Now they're figuring out it's not a real quarantine, so they're starting to come back, and nobody comes to Hawaii to spend 2 weeks in their room. I mean, that's ridiculous. So, but if we educate them and say, look, you're going to come here and you've got to get tested before you depart, and it's got to be a good test, right? It's got to be a negative. If you show up and you're not tested, you will go to a real quarantine where you'll get a room with no hotel key or something like that. Kawakami Derek seems to have something figured out over there that works for them. They've got a lot less people that are going to come to them that are going to come through Oahu. I mean, at our top, we were 30,000 visitors a day, or travelers, I should say, travelers. So every traveler who comes in has to be tested prior to departure, or they got to pay for it when they get here. And if they fail, they're in a real quarantine, which they got to pay for. So that's where the Department of Health, I'm sure, doesn't want to, that they look at that and say, oh, it's too much work. Well, we have the opportunity because of our location and geography to keep our rates low. And we have the moral responsibility to our families and multi-generational families all living together to keep it low. And I just keep thinking about the poor people flying those airplanes, the flight attendants getting in, picking up a group of people in LaGuardia, New York, and they're not tested, you know, and I just, she's going to bring that flight attendant's going to bring it home to her family. So those are my thoughts. But Gene, we've developed a consensus. I think LG Green, UH Hero, the law school, president of the law
Ophie,
yeah.
Safer, yeah.
I mean, everybody seems to understand that this makes sense. And the reluctance between Park and Bruce, I don't understand. I just don't.
But now Bob, they got all the power and the money now, so I hope they're going to get a little bit of an understanding by osmosis. Hopefully.
Other than it's just too much work. I mean, they say, well, it's not 100%. Well, of course it's not 100%. That's not how they approach condom distribution in the schools, though, is it?
Bob, using your LaGuardia example, will it take somebody like Walter Riddy and Molokai, where they have already said visitors go home and take your disease with you? Will it take some kind of an incident like that to wake up Park and Anderson? Who knows? I hope not,
Yeah.
but
I think you can inevitably see, if we do not do this correctly, two things are going to happen. One, it's going to be a giant mess, and David's going to shut everything down again, because our capacity for healthcare is for a population of 1.2 million people, right, statewide. So, but we bring in these visitors every day, right? They add to the burden, and if they get stuck in the ICUs, they're taking the beds that would normally be going to local residents, right? Because normally when you come and you're on vacation, you're not going to get sick. You're not going to tax our local resources. So very quickly, the UH Hero report showed that the numbers could very quickly get us into a position where, if we don't do it right, we're going to have problems with ventilators.
And Bob, overall, this is a real test of leadership. We need to know what policy is best for the people of Hawaii. And that is going to be really on trial for the next 2 to 4 weeks, because what we do when we open, we've got to do it right. Everything says the most conservative plan is the one that we're talking about, the one that Josh Green is talking about. And if they do short of that, just because they've got a medicinal background and a stovepipe perspective on this, we are going to be in deep kimchi. And I wish the best for Anderson and Park, but if they're going to have all the money and all the strength to do what they want to do, and they don't do this testing, I think we're going to start ending up killing our economy. And Bob, some of the things you said, we're going to end up killing people. And that is not what we were elected to do.
No, we've got to do it. And the thing is, it can be done right. We've laid the framework out. It's gonna, and if you add the National Guard into it, the military precision that's going to be required in some of the things, like the way we check in the building in the morning. People don't know the National Guard takes our temperature there, right? So it's not militarization of it, but they can be ordered and told to be at certain places where civilians cannot be treated in that particular way. As veterans, we both know that, right?
Oh, you got any other questions? Otherwise, Bob and I could talk for 2 hours about what the economy is going to have happen here.
This is an issue that you both have been very passionate about, both in the House committee and on the floor. Unfortunately, we just ran out of time.
I wonder why.
So many things to talk
about.
I want to thank you both for joining us, and again, to Olelo for all the work that they do behind the scenes. We will have a lot more to talk about next week. Aloha.
Okay. All right.
Aloha.
Thanks, Olelo. Thanks, Kyle.
What are you doing? We have to go. I'm gonna be late for work.
It's Tuesday morning. I gotta record live at the legislature on Olelo. Senate and House leadership discussing what's happening at the state capitol.
So just watch it on the news tonight. Come on, let's go.
Hey, this is like getting the news before it's news. If only I could get this remote to work.
There. Can we go now?
No DVR? No problem. Watch Wednesday evenings at 7 p.m. on Channel 49.